start a little early?
Well, we still have people joining, so you can usually start the.
Okay, it's 9 o'clock. Want to say good morning to everyone. Thank you for joining us today. My name's Kim Schlessinger. I am on the MLAC committee and the co-chair of this subcommittee along with Emily. Emily, would you like to introduce yourself as well?
Yes, good morning. My name is Emily Rivas. I am an RN. I am on the MLAC on the member side. I'm glad to be
Hey, Emily, we're having a hard time hearing you. Can you?
That doesn't surprise me. I'm kind of losing my voice.
Oh, okay. All right. No worries. Okay.
Am I understandable for now? I'll speak a little louder. Yeah. Again, thank you, Kim. I really, yeah.
Great. Well, a couple introduction items is there is a website on the subcommittee information. The agenda and the initial subcommittee letter is on the MLAC website. And Terry Watson, our administrative help here, is going to help us through this first initial meeting.
Absolutely, that's what I'm here for. So this meeting is more about logistics. I don't know how much we're going to get into the discussion. Emily, I wanted to ask permission I did print out your email. It is in the back of the room. I'd like to post it on the MLAC subcommittee website if you're okay with that, Co-Chair?
Absolutely. I wanted to make sure that we had that Kim had a chance for buy-in, and any adjustments that she wants to make is like that was a draft for maybe scope and some lofty objectives. And so if we can talk about those today and we get our consensus, I'd be more than happy to have that shared.
Okay, great. Co-Chair Schlessinger, do you have anything to add to that email?
I do not. I think it's a great starting point. And thank you, Emily, for putting that together. I think, we may want to possibly tweak it as we go along, but I think for the initial start, it's a great foundation.
Okay, great. So there are copies in the back of the room. I haven't sent them out, but there you go, Sean. And I will get that on the subcommittee website as soon as this meeting is concluded.
And I am actively hunting for that email so that I can speak to it more. I'm not going to be able to speak to it from memory, so I'm fine. I'm hunting for it right now.
And I would put it up, but Bob is not in the room right now, so you're going to have to wait just a second. So
Emily, I think it was on May 13th that you sent it out.
Yes. So when Baba gets back, we can put it up on the screen and take a look at the email. It shouldn't be too long. Okay, so we'll do that. We'll put it up on the website, and maybe we can review it at the next meeting. How's that? That sound okay, co-chairs? And when Bobby gets back, we'll take a look at it.
Yeah, that's fine. I mean, I think if the intent of this meeting is to sort of get the structure for future meetings and kind of get agreement on the scope, we can at least touch on the scope statement and make any changes that we want to do there. And that may guide the frequency of meetings and what additional stakeholder information, which may answer some of the agenda questions.
Perfect. Okay. Oh, she's back. Sorry. Do you have Emily's email? We wanted to put that up on the screen. I can forward it to you if not.
Mary, while we're doing that, would it be okay to find out who else is in the room today? I'm just kind of curious of who took time out of their busy days to join us.
Absolutely.
Sure. Good morning, Matt West, Administrator of the Workers' Comp Division, here to help with the discussion, be part of the discussion.
Dr. Vern Sabo, Oregon Chiropractic Association. I am in Albany, and I treat a lot of Samaritan folks and interested in access to care.
Sean, would you like to come up to the table?
Yeah, Sean Miller, the American Property Casualty Insurance Association.
Stan Fields, on the division's managed care specialist.
I'm Gary Kuntz. I'm the medical policy analyst for the work comp division.
And me, I'm here. Terry Watson, administrator for the Management Labor Advisory Committee. Sorry. Okay.
Thank you.
Let's see. Okay. Did you find the email? I just sent it to you. Is it coming?
Give me a second, it's taking a while.
Okay, sorry. Our internet is having issues. Okay. All right. Let's see. I was looking at the virtual room, Co-Chair Schlessinger and Co-Chair Rivas, and I was wondering, is there anybody else that maybe should be at the table that isn't at the table? Can you think of anyone?
So you mean as far as being part of this subcommittee?
Yes.
Yeah. Well, looking back at the notes, how this subcommittee came about was due to the House Bill 3374. And so I think the persons involved in that bill, it would be nice to have Evo and Elaine join us in this subcommittee.
Hey, good morning. Elaine Schooler with Safe Corporation. I'm here remotely due to some other obligations. And I think that Rivas as well.
Great.
The other, I'm looking back at my notes, I had Sean Miller down. It looks like Sean is in the room, so that is great. And I also had written down, and I know I'm gonna say this name wrong, but it's Thais, Thais, Lomax with Sedgwick. And I also have in my notes Ann Klein from Majoris Health Systems.
Co-Chair, there's Ann.
Let's say, I am here. I don't know if my video is working, but I am here and very willing to participate. Thank you.
I would also love, and I'm not sure who to voluntold this for, but I would really love some participation from a representative as a nurse practitioner, if we're looking at expanding access to care to include additional provider types. I'm happy to speak on behalf of nursing and healthcare, but I am not direct provider, so I would love, and I can work Jack.
Okay. Okay. Co-Chair Rivas, it looks like Jack is on the meeting today, so.
Yes, happy to participate. Thank you.
Yeah. Okay. There we go. Okay. All right.
So as Kim mentioned, this subcommittee came about from Houseville. And I'm just curious, when we're talking about access to care, it's such a large topic. But I do think to address it might be a great place to start. So I drafted a scope statement to try and put to paper what we're really trying to do and want to kind of get buy-in if that's really what this is, the purpose of this is, and what we're looking to try and solve or begin to solve. So
Is it good? Should I stop sharing?
Patricia, should we leave this up, or would you want to take any questions or?
Yeah, does anybody have any comments or any additions or edits that they would like to make to this?
We can't see if anybody has their hands up because we're sharing this scope statement. I apologize. Can you?
I don't see any hands up on my screen.
And again, I apologize. Oh, Evo has it. There we go. Now we can see some hands up. There we go.
Yeah, I'm happy. Maybe I'll go first. It looks great to me as an initial statement. So if you're looking for feedback, thank you for putting pen to paper.
From my perspective, 2 cents in, it may be worthwhile in discussing the perspectives to also specifically highlight self-insured employers, since they're a different subset, and slightly selfishly, specifically other ancillary partners in the system, such as managed care organizations or the third-party administrators.
Thank you. Thank you, Anne, for that. And why, also, Anne has provided a white paper that really is, excellent. It's very timely. It was put out in April 2024. It was an MCO's perspective in access to care in the state of Oregon. I had a chance to look over it this weekend. It's very comprehensive, and I think that would be a really valuable resource for this subcommittee to have. It looks like a lot of work has been done on this topic, and don't really need to recreate the wheel when it's already been done. Anne, did you want to maybe just speak a little bit more about how that white paper came about?
I'd be happy to. It's really an evolution of the access to care challenges for workers' compensation and generally in the state of Oregon it's not a new thing. It certainly though was exacerbated by the pandemic, and I think some of the already existing stress points and fractures were just really hit by some of those changes. And as we continued our work on navigating from the MCO, how do we continue to facilitate and support care and partner with providers, we really identified we were fielding questions from a variety of stakeholders asking us, can you quantify what you mean by access to care challenges and barriers? What does that look like? And that is a big question. But we figured the best way to really tackle it is just to get started. And so that white paper was our first attempt at trying to consolidate a lot of the different information, statistics that we happen to, could we get, outside, looking at, for example, the Oregon Medical Board licensing and the information that we could pull from that, other external resources, both Oregon and federally, there is information regarding access to care and the challenges. It's really not unique to the work comp system or to Oregon. And so we also tried to pull in some of that reference and perspective. We feel like that context is very valuable. We then start to drill into defining what the problem is, and the reasonable and likely solutions for our subset of that broader healthcare space. And so this was, I would say, an attempt to try to provide a comprehensive, to set a platform for further discussion. There is absolutely more data out there, information, perspectives that is necessary. This just felt like a good space to say, here's some of the stuff that we do know, here's our best way to start quantifying. And we hoped that it would create a better platform for discussion. And I noted, Emily, in your problem statement and scope recommendations, part of it is looking to be data informed. And that can be tricky when it's as expansive of a problem, challenge, lots of complexities. But I do think it's really valuable to start there.
Co-chairs, can I ask a question? Is that okay? Yes. Emily. Anne, would it be okay if I put the white paper on the subcommittee access to care website? Is that okay?
Absolutely. Yes, we really developed it to share to set a platform for conversation. So please do share.
Okay, I will post that as soon as this meeting's over with Emily's email as well. Okay.
Who produced the white paper again?
Majoris. Okay, great. Okay.
Well, that kind of leaves us back to, how do we want to move forward with this subcommittee? Emily mentioned it, it's a big topic. And I'm still trying to wrap my brain around how, how this subcommittee is going to function. What are we going to, dial down to? Really, what is our purpose? And so how, looking to some of the people in the room, how do you envision this working?
I'm not in the room, but I'm going to speak anyways. Looking at some of the objectives, which are pretty broad, right, on purpose, because I'm trying to create structure around what we need to do first. It sounds to me, that a little bit more work on the infrastructure as to who's going to be at the table, what additional information we need. I want to try and put more tangible answers to some of those objective statements if we could. Specifically around identifying the barriers, and when we're talking about who's going to be at the table, that we're looking at end user data as well, which may end up being a bit more qualitative than quantitative, and also going to be something that we ourselves as a subcommittee need to start partnering with to gather. I mean, OCN has some decent workforce data for nursing specifically, but there's a ton of industries in which we need to try and gather some of the bigger problems from the perspective of the end users or the worker, to help dictate how we start to solve. We're not going to solve this problem as a single thing, right? But what the barriers are, we may be able to find simple solutions. We may be able to provide additional information to the MCOs on the way that they operate within the confines of the 9,000 different regulatory boards that they have to navigate. But I want to make sure that this conversation and this work is fair and including the people that are most affected, which are our workers across the state. I want to look at the impact of non-physician providers by partnering with non-physician providers to help us decide what additional information or research needs to be done around those barriers. So that's what I want to spend this time doing. What do we want as a cadence? And then what action items do we need by what time to meet some of these goals towards the end of this subcommittee's work, how long does this subcommittee go, Terry?
It's probably through the end of September, I think.
That's helpful, right? So I need an end date, and then this is great to work backwards as far as what a cadence is going to make sense. Because I don't think between now and September that we're going to be able to fully understand the depth and breadth of the barriers to access to care. It's just very complicated and dynamic system, this healthcare that we live in. But what we can try and solve is making sure we're getting everybody's perspective and starting that larger conversation, even if it needs to continue back in a different form. And so to me, how many meetings do we want to try and have along with everything else? And then from there, what our next steps are for meeting? Are we meeting with our stakeholders and advisory board time? Are we going to connect with them 3 times in the span of, to September? So, I don't know what you think, Kim.
Can I ask a question?
We have a question in the room, Co-Chair.
It sounded like she said that one of the things to get started is to get perspective issues from stakeholders. Did I hear that? So
Yes.
how have we decided how that's going to happen, by email or?
We have not. We're just talking right now.
I'm having trouble understanding what you're saying. So.
Yeah, and she said her voice is.
Oh, okay.
It's her voice. It's not volume.
Okay.
Yeah.
Right.
Yeah. My apologies. I don't have a great voice right now, so forgive me. But yes, my thought is we would do cadence, and then from cadence, action items as far as what we need to articulate to the stakeholders and how people are going to be able to provide that feedback to us in a meaningful and intentional way. So we're getting there.
Thank you.
Feedback. Yeah.
So with the first part of that, Emily, the cadence. So are you like as far as meeting, once a month, once a week?
I hate to add another meeting to our calendars, right? But I once a month doesn't feel like we're going to really be able to get anything meaningful done as far as advising. I mean, once a week is tough, but does feel like, right to me. There's just a lot of conversations that need to happen. And so, and I say this with the fact that there's several weeks I already would not be able to attend. And so maybe we do bi-weekly, and then because that seems, fair. And then there may be some work that needs to be done outside of the meetings with some conversations and some discussion and data gathering. Does that feel right to you, Kim?
Yeah, I think that would be doable.
Gary, is that doable from your perspective, since we need your help?
Can you say that one more time? I'm sorry, I was texting. I apologize.
No, that's fine. A bi-weekly cadence.
Bi-weekly. Yes, that's doable. Yes, I apologize.
I'm sorry again for my voice and whatever connection issues we're having.
It's okay. Yeah. Yes. Okay. So bi-weekly meetings. I did print out calendars. Let's see. Meetings for June, July, August, and September. Because we have to book a space here.
Yes.
So looking forward.
Terry, did I hear right that the goal is to have something like a report back to the full MLAC committee by the end of September? Is that what I heard?
Yes. And it may be that we start meeting bi-weekly and then we things are moving along real great. And then it could be like our legislative meetings. We plan for them and then we don't need them all. So we could, right? There's that possibility that we plan all these meetings and then we don't need to meet as much as, did everybody's computer freeze or is it just mine?
Just you. There you are.
Okay, all right, it's just fine. So we can go ahead and plan the meetings and then, yes, so the end of September would be best. I'm gonna look up there because this is being weird. So yeah, we can go ahead and map our course and then see how things are going for the meetings. And Emily, I did not print out your schedule. I meant to do that this morning and I got sidetracked.
Oh, I don't want to bore the participants and regale them with the number of
Okay.
that I am not available, but I will do move some stuff around to make it work. It's just this portion of my life that is a little busy. So.
Okay. Okay, let's see. So what days work best for you, Coach Rivas? Would Wednesday, June 4th work? Sorry, this is going to be a process now.
Yes.
Okay. All right, I'm just going to, and June 18th?
No, but that would be the only other one I can't. Like that's the only one. I return home on the 18th and then I'm back on regular schedule. So that would be just fine. So I could do.
Okay.
I'm looking.
Friday the 20th?
No. No, yes, I can make that work. I'm gonna have to push my bargaining, but that's fine. I'm on a large bargaining team. I will make that work.
Okay.
Yeah, that.
And then
I'm grateful for you accommodating. The 20th will be just fine.
Okay. July 10th?
Yes.
July 24th?
As far as I know, yes, that's fine.
Okay.
I don't want to speak for you.
Okay. August 14th?
Yes. Are we keeping this same time?
Let's see. Yes. Let's try to keep
Mary,
the same.
I hate to throw a wrench in here, but the June 4th is fine, but not the timing. I can't do between like 9:30 to 11:30 on Wednesdays.
Okay. Okay. Let's see. Okay. Wednesdays. What about the 6th, Friday the 6th? Oh, Emily, you can't do the 6th, can you?
No, but I can do any time on the 4th. So whatever would work for him, we can move the time. And that's no problem.
What about 1 to 3?
That would be fine.
Yep, that's fine.
Okay, let's move it on the 4th. Okay. Okay, and then the rest of the meetings are on Thursdays. Okay, now we're back to August. Okay, can we do the 9 to 11 on Friday the 8th?
of
On
August?
August 8th, did you say?
9 to 11.
Yes, I can.
Yes, August 8th is a Friday, and I can do that, yeah.
Yes. And then the 22nd, 9 to 11.
Mm-hmm.
Okay. Which leads us to September. Let's go for the 12th and the 26th, and they're Fridays again, 9 to 11.
Mm-hmm. That's
Yes.
fine.
Does that work for everybody? Okay. Okay, so that gets us through the end of August. And if we need to like massage things a little bit, we will. But we got the dates booked. And I will send out a recap with a schedule and put it on the MLAC Access to Care Subcommittee website. Okay?
Thank you.
Thank you.
Okay,
I did not
that's done.
put that into my calendar that fast, but I will, with the summary, make sure I block all of those off.
I will take care of it for you. Yeah, and we'll get the Zoom links and everything. It'll be emailed out to everybody, okay? Or it'll be on the Access to Care Subcommittee website. Okay, great. Okay. Oh, okay, let's see. Co-chairs, is there other data that we need to be looking, that staff here at WCD should be looking for?
Well, I think that's hard to answer right now since we're not really sure the specific, issues. The white paper that Anne shared has a lot of good data in there. And so I would recommend, reviewing that resource first, and then that might generate, some additional questions. Looks like Anne, you have your hand up.
I was just going to offer, I agree with you that the whole goal was for it to be this starting of some good conversation. And I think it generates easily follow-up questions. I, in fact, know that definitively because I have had follow-up questions from various folks who have read where we're already starting to pull some additional data or different ways to look at the data. So I could suggest and offer to walk through the white paper, what we've attempted to do, what barriers we came across when we pulled the data we did, and also bring forward some of the additional data we've pulled together based on follow-up questions. And I think it could be a good starter for just thinking about where next, and what's missing in that white paper that we could try to source and who could source it for us. So I'm at your disposal.
That would be great. Maybe for our next meeting, then, we'll give people time to access that report and look through it. And then, Anne, you could, provide, more of the background information and, what other things you have seen from that paper.
Absolutely.
Carrie, do you know if outside of the MCO perspective, there's been data gathered that would sort of crosswalk or mirror this white paper's collection of data?
I'm going to ask in the room because I'm not certain. Do we know if there's other data outside of the MCO data?
Yeah, we have some data.
Some data? Okay. Okay.
Yeah, we'll see. We can see what we have what data we have at WCD, and then on the topic, had a conversation with our research team, and they're looking into kind of on the provider side. We're trying to see if we can determine, the total number of providers in Oregon, and then based on the medical workers' comp billing data we have, like how many providers are actually operating in the workers' compensation space. So that data might be helpful to see.
Yes.
So we're working on that. We're hoping to break it down by nurse practitioner, physician associate. So our team's working on that data. So hopefully we can come up with something that'll help with the discussion.
Would it be worthwhile to look at urban versus rural, areas as far as providers is concerned?
I would think, yes, we'll try to see if we can break it down by region. We'll have to look at the data, but I think that would be helpful since, you know, there are probably different barriers in the
Right.
rural communities versus the metro area. And that's highlighted in the white paper as well.
Thank you. That would be.
So yeah, we'll work on getting as much data as possible for y'all.
We have a couple hands, Terry, it looks like, Anne and then Evo.
I was just going to offer as some other potential sources of data. It won't be specific to workers comp space, but I think that itself can be very informative. The Oregon Health Authority has several initiatives that they're working on that are around the same concept and challenge. And the Oregon Health Forum is another organization entity that is covering this topic. And I think there's some good data out there as well that could add context and support the discussion.
Evo?
Yeah, thank you, Kim. I just wanted to offer, we shared some data with MLAC, I think last November, it feels like, or so, sometimes in the fall. And we have updated data on medical billing, medical cost, medical inflation, waiting times, or rural comparison. So we'd be happy to kind of share an updated version of that. That's helpful.
That'd be great.
Yes, please.
Mm-hmm.
And maybe, and I'm assuming Ian is thinking along the same lines. It might be helpful if we provide what we have, but then also do a walkthrough with some of our actuaries so somebody can answer all the data questions there. But
I'm just trying to figure out the best way to try and gather some of the data some of the gaps in data that may be there for our end users or injured workers, as far as some of the issues like transportation, distance in some of the rural areas. I know that data is much more difficult to gather other than to have conversations with affected workers. And so I don't know if that has been done before. Not a full listening tour of that nature, but I'd really love to get more collective perspectives formally somehow.
maybe Emily, if I may, we are doing some surveys of workers, and we'll look what we have in terms of what data is reflective of medical questions there. And so if we'll take a look and then maybe circle back to offer some insight.
Kim, if I may, for the next meeting, like with some of these initial discussions, I'm happy to try and draft a full-on problem statement to kind of guide the work from the scope perspective as far as an action item is concerned, and then those who are sitting at the table can kind of weigh in, and then we can have a, formalized. That sounds good.
Thank you, Co-Chair Rivas.
And I also want to I'm trying to figure out too how we really get the non-physician provider perspective. If, we have some people who are here in the room now who are very engaged, and I know that in disciplines there may be, but I want to try and gather those people together. I don't know if it's worth connecting with the associations for PT and PA that may have either policy analysts or GR relationships, so to speak, with us, and have some of those specific non-physician provider perspectives that may help us organize something more than time. Probably very
Terry, I heard most of what Emily said, but I'm getting a lot of feedback. It's not, I don't think, Emily, it's your voice. I think it's just, there's a lot of like reverberation or something going on with the audio. Are you getting that? It looks
Cutting out.
like some of you are also agreeing to that. So I think, Emily, I heard most of what you said about maybe getting some other of the stakeholders from the providers, like the mid-levels, and whoever else, whatever who else who might be eligible to be providers.
Chairs, I'm happy to reach out to the different associations, and if you said like the people that aren't quote, quote, doctors, the non-traditional providers, am I paraphrasing correctly, Co-Chair Rivas?
Yes.
Is that correct? Okay, so I just want to make sure I had it right. I can send emails out to the different associations and make sure that everybody's invited, and send that letter that the MLAC co-chairs drafted, and make sure, and if I don't hear back, make sure I follow up with a phone call. And we're also having bandwidth issues, so that might be part of the audio issue. I apologize for that. We're in the basement today, so that might be part of it. It may not be all your voice, Co-Chair Rivas.
Yeah. Yeah. Looks like Evo has his hand up. Evo?
Yeah, thank you, Kim. Terry, I was wondering, it might be a good idea the treatment matrix that WCD has, the different provider types and how they treat within the system, to share that with the co-chairs, because that might also be a pretty good indication which provider groups should be around the table. I'm happy to follow,
okay,
but it's on your website.
thank you, Evo. Okay. All right.
Okay, so I guess, is there
Kim?
anything else? Yes?
Can you hear me okay?
Yeah, that's better. Yes, thank
Okay,
you, Emily.
I'm just going to talk directly at you. I want to make sure I'm clear on what our end goal, right, is for this subcommittee. Are we looking at just providing a set of recommendations? Like, I know that we're looking at pinpointing some of the larger barriers that I think we all know in theory, but to have the data backing where the largest barriers that DCBS, WCD can actually start to move the needle. But of the solutions that we work together to find, are we creating a recommendations document, present to MLAC to then present to greater legislature? What is our end goal with this information that we're gathering and those solutions that we're going to hopefully find?
Well, kind of from in my way of thinking, that we're looking at this issue, we're exploring all the problems, and then possibly after, we kind of identified, what all the barriers and the issues are, that maybe there might be a couple that we can move forward with. So maybe it's like we identify and then we say, well, these one or two are something that maybe MLAC could help, move forward to a resolution, or to come up with some remedies to this problem. That's how kind of I see it. Or, we may just realize that it's so big that there's nothing we can do. I'm not really sure.
And that's super big that there's something that can be done. I'm just trying to look at it from the lens of us as a larger advisory committee, right? Like we don't legislation. I know that we're working with partners. There are components of that bill that I think could quickly solve some of the barriers, not all, but some. And so I want to make sure that what we find and what we decide creates recommendations that are actionable and purposeful. So I just, Jerry, in your history or your perspective, do you feel that a report with a list of recommendations for the larger MLAC to review and then provide board makes sense?
Co-chairs, this is my first subcommittee, so I'm sorry I don't have history to pull from. We're all in this together as new subcommittee people.
Yeah.
The administrator might have a better idea.
Sure.
He's new too.
Yeah, no,
that.
I think that sounds like a good sort of end goal, right? Some potential solutions. You know, as we're looking at, it's multifaceted, right? So from our perspective, if the subcommittee identifies some clear administrative burdens that WCD can help mitigate via some rule updates, or, you know, if there's a problem in the statute administratively that, you know, that we need to run a legislative concept based on MLAC's recommendation, we can look at doing that. I would imagine, you know, other stakeholders, you know, there's the legislative concept or the bill that SAFE had put forward. And so if some recommendations come out, I would think there are probably others that may pick up some of that. But I think to the larger committee, and then we can go from there.
Thank you. That's
we'll look into I see Lon's hand, and I know Lon was part of MLAC a few years ago. We can look into that, like, historically, has MLAC ever like ran a bill? Like, I don't know the answer to that, but we can certainly talk to those that have been around longer.
Yeah. So Lon has his hand up. Is that right?
Yeah, I don't. Can you hear me?
Yes.
Co-chairs, my name is Lon Holston. Members of the committee, my experience in the past with study groups and studying issues that we needed to address, usually when you get close to the end, you begin to realize what would be statutorily needed to be changed, what could be changed in the rules, and what you couldn't change in this process, and you may have to table it for a later date for a whole different group, or maybe there's not a thing you can do about it. I know that in the past that there has been tons of testimony on these committees, which is always good to hear from all sides. And when you get down, like I said, and I agree with Matt, some are statutory, some are rules, and some there's just things you're not going to be able to deal with. So with that, I encourage you all to keep an open mind, work hard. I'm willing to participate as much as I can. And over at MAC, I'm sure we're going to have some discussions over there to help backfill information for this subcommittee. So thank you.
Lon, just for my, just trying to get up to speed with everybody, can you give me a little bit more information, like where you're from, what your involvement was?
My involvement started in 1980 or 1993 and 94 with the workplace injury. From that point on, I lobbied at the Capitol for 7 years, was appointed to MLAC, was eventually co-chaired MLAC. We did the study groups for lots of issues, including the IME study that produced a bill in 2005, which Governor Kulongoski said was the largest overhaul of workers' compensation in 16 years. Now, for me, I didn't think it was that big, but he certainly did, and I appreciate his accolades for that. I was appointed to MAC, and 2009, and my current appointment lasts until 2026. I had been conducting and going to meetings with MAC since 1996. So I kind of have some experience within the legislative world, the workers' comp world, MLAC world, and MAC world at the same time. So I'm willing to do whatever I can do to help you folks out, because I know this is not going to be easy and it's going to get rather tough at different times trying to make decisions. So with that, that's kind of my experience. Sometimes I'm referred to as the old policy guy. Now, I can't understand. I don't know whether that is I can't tell you what that means. So anyhow, thank you.
Thank you. I appreciate that background. Thank you. And I also appreciate your willingness to help with this current group.
Thank you.
So since we're all new here except Lon, no, I'm just kidding. Looking at next meeting action items, it does sound like we're gonna actually take the time to review that pretty comprehensive white paper, which admittedly I have not had a chance to fully dive into, and may hear from Anne to kind of explain and walk through some of that data for participants. I will draft a problem statement that will just hopefully even simmer down beneath the scope as to what we want to try and create solutions for. I plan to review any data that comes our way. I don't know how long it takes to gather some of the things we've asked of DCBS. So as they come in, we can kind of touch on those things. And then I guess from there, slowly start to build the advisory panel and then the work that we're really trying to do. Does that sound right? If you
I think that sounds like an excellent recap of what we need to do for the next meeting.
I also want to make sure that we review again in depth 3374 at its last iteration. I know it's not, it's been reviewed, but I want to pull some of those components out as far as when we're talking about expanding access to care. There were a couple of different ways that bill to do that, and I kind of want to look at each of them components separately. That's a meeting.
Emily, I'm going to make sure I heard that right. You want to pull out some of the components of the, what was that again?
I just want to make sure to review 3374.
Oh, 3374.
Yeah, the bill had several different solutions that are kind of spokes on this larger wheel. I want to make sure that we review them in chunks as to what recommendations we might make if we wanted to try and re-present that bill in a different form, or that concept in a different form. Because again, we're not going to make recommendations draft brand new legislature because we're not reinventing the wheel. We just want to kind of look at where there were concerns from MLAC members as to the putting into practice the components I want to talk about.
Okay. Yeah, I think that's a very good idea, since this is the reason why we're here today, is the work that was done on that House Bill 3374. So yeah, I think that's a good thing to do.
Co-chairs, would you like me to put that up on the, co-chairs, would you like me to put that up on the subcommittee access to care website? That way you can just go there and link on it? Okay.
Yes.
Happy to do that.
Thank you, Terry.
All right.
The only other thing I have a question on is to answer Vern, who had an earlier question about pathway to feedback or input. What would be the best way as we start to formulate this work? And more concrete way to receive feedback or input. Do we want it in a formal letter? I'm just not sure. I want to make sure it's clear for stakeholders and people who are engaged in this work. They feel that they understand how to contribute.
I have no idea what she just said.
She said the best way to provide feedback from stakeholders on access to care. And she was pointing that question at you.
Oh, email.
Email?
Yeah, I would think. In preparation of a meeting.
But how would we get that message out to people? Email people?
Oh,
or-
you're saying, I thought within the subcommittee.
Yeah,
So you mean to survey the field?
or how do we, first of all, get information out to stakeholders, and then second of all, collect that information?
Well, what we have, in my profession, we have a statewide communication platform, and we can send it out that way. Are you talking about something that I would send out or you would send out?
It'd probably come from me, but how do we get information out to not only your association, but to all associations so that they can provide feedback on access to care? Do I have that correct, Emily?
Check your text message, because I know I'm hard to hear.
Okay, all right, okay. Just a second, just want to make sure it's correct. Okay, the best way for you to communicate your concerns to the subcommittee about access to care.
Okay, well, I would think maybe surveying my folks, but then coming up, encapsulate it and get it to you. You disseminate it?
Yes.
Yeah.
So email, that would be the best way? Okay.
I think email, yeah.
Okay, all right. And we email frequently, so that would work.
Yeah.
Okay, all right. Thank you. Okay. I think I was making it bigger than it needed to be.
Was that kind of in general feedback through Terry?
Yes. Okay. Got it. Okay. Got that one. Okay. All right. Okay. Great job, co-chairs.
Well, thank you, Terry,
But
for
yeah, in your
holding our
subcommittee
hands through this.
experience, in your vast subcommittee experience, Terry, you think we did a great job because it's the first one for everyone. So.
Okay. My computer's freezing again. Okay. Great.
Well, I think we covered everything that was on the agenda. We got our meetings. We talked about data, who should be at the table, when we report back to MLAC. Is there anything else from this group that they would like to, discuss or comment, or make a point about what this subcommittee should be doing? I don't see any hands on my screen. I don't know if I'm missing
Co-Chair
any.
Schlessinger, there is no comments in the room.
No further comments? Okay. Well, and so I think we have our homework for the next meeting. And then we will reconvene then and keep going on this important topic. Just want to thank everyone for coming today and helping us through this initial meeting, and just trying to move this dial a little further towards improving access to care. Anything else, Terry or Emily, before we sign off? No? Okay. Well, then I guess we'll go ahead and
Okay.
adjourn. Yeah, we'll adjourn. Thanks again, everyone.
Thank you.
Thank you.
Still don't have a time. Still don't have.
Don't like that.
I kind of got that.